Well, while we're in Guernsey, we've had a chance to look at what's going on in healthcare, and it's fascinating. Heidi's here with us. You're like the Minister of Health in our terms, sort of thing. I know it's slightly different terminology down here, but I mean, you and your team were down at the Pride the other day, and they all came on stage, and they got the most incredible applause from people. They really seem to have handled this situation with COVID in such a way that both our islands are free of it. But you seem to be leading from the front. Can you explain what made it happen for you here so that we are COVID free?
Well, it's been an absolute community effort. I mean, it really has. Everybody has put us in the position we're in today. And I think we've been developing over the last 4 years a new model of health and care, which we call the Partnership of Purpose. And we really saw that in action as well. From we had primary care, the hospital working together, the third sector, all coming together to make things happen. We've been led by an excellent Director of Public Health, and it's about everybody working together, the team, the core team at the top, really, working in an atmosphere of trust and mutual respect, listening to each other, listening to the evidence and taking it from there.
Yeah, I mean, the public health lady, she's been everywhere on all the networks, the news around the world. You're more driven by the science than politicians, because it's a tricky one, isn't it? They give you suggestions and you have to implement them.
For me, it's been useful because demonstrating what I've always stood by as a politician is to make evidence-based decisions. We can be provided with the evidence and the science might be there, but there's always that political judgment needed in how you interpret that and how you actually put it into action. So we're given the evidence, but it's then what do we do with it? And so that, from our point of view, from a health and care point of view, it was looking at, well, what do we need to do with the hospital, but also how do we deal with lockdown and then moving out of lockdown? What that balance of risk that we could take as we eased off those regulations.
And of course, your near neighbour Jersey has gone a different way, and that add extra pressure, because obviously the economy is driving these things as well as health, and it's this balancing act, isn't it?
It's always been that balancing act, health and the economy and the impact of the economy. For us, we always knew that what we wanted to avoid was a second wave, and trying to absolutely minimise that if that happens, and also the belief that by being free, I mean, now we've got no restrictions on Ireland, unlike Jersey, means there are no issues over social distancing in restaurants. Schools can go back with minimum issues there, and the economy, to all intents and purposes, can move normally. The problem is, of course, the borders, and that's the difference that we've taken. We've said our biggest risk is through the border, so that's where the control is. If we changed that and said, okay, we want to free up the borders, we then would have to look at what non-pharmaceutical interventions we brought on Ireland again. And it's understanding what the community want. I mean, not everybody's happy with that. And a lot of people, including myself, would love to see family in the UK. But there has to be a trade-off from if you want to free up the borders, you have to have more restrictions here. All about preventing that spread of infection.
Well, the airports we came through, there was a lot of building going on. Is that a COVID centre that eventually that people will nick off the planes, they'll be tested? Is that the plan?
Yeah, we're looking at what's called Phase 5C. So that will mean that people are tested for the moment they arrive, and then we'll have later testing. But basically, it'll be built around having different group countries, so like we have now, A, B and C, and that will determine whether you can go through what is 5C, which will open the borders up more. Now,
you've done things you're probably ahead of the game compared with us at the minute, that anyone can come in as long as they do the isolation. That right? We've had people as guests, but in the Isle of Man, of course, we haven't got that far. Can you take us through that? What that is all about?
At the moment, we've got 3 different group countries. So we've got Group A countries where anybody who's been there, say to the US, would have to self-isolate for 14 days if they came over. There was no other option. If they're in a Group P country, which has until recently been like England, Wales, Scotland, then you can take a test after 7 days, and if that proves negative, then we have what's called a passive follow-up. So we ask people just to be careful what they do, don't go to busy nightclubs, stuff like that. So just in case there might be that extra risk afterwards. And then we have Group C countries, which is our friends from the Isle of Man. So
Yeah.
there are no restrictions at all, which is absolutely fantastic.
And that thing about people can isolate, so someone from the UK or wherever can come here and follow that thing, because in the Isle of Man we don't have that yet. Do you talk much with your counterparts in the Isle of Man to explain what you're doing? And
there's been a real close working relationship with Director of Public Health in the Isle of Man between your Director of Public Health and ours. In fact, we saw your Director of Public Health came over to us about a year before, talking to us about the use of nice drugs, which we really appreciated at the time. And I think there has been a lot of conversations about what the Isle of Man's doing and what and the other way around as well. So yeah, it's about doing what you believe is right for your community at that moment in time. There's no right or wrong answer. We won't know until this is all over who did the right thing and who didn't. It's all we've been working from a blank sheet of paper.
How is your economy doing then under the circumstances?
It really has bounced back, and now of course the one area that it's hit is tourism, but that's a much smaller part of our economy than say finance industry, digital, and other areas that really. I mean, if you go into St Peter Port, and you might have seen how much buzzing the restaurants and the nightlife is. It really has. Almost gone back to normal. The people that hit are the tourist attractions and the hotels. Of
course, you were over 100 days COVID-free.
Yeah.
We were similar just behind you, but then we got a case. I think you got yours on the same day as sort of thing.
Yeah, well, our case was a day after yours.
Day after, was it? Did that, was it shock, or did you expect this to happen?
No, this was absolutely expected. We never aimed to be COVID-free. It was really because of the fantastic efforts of the community that we ended up being COVID-free. It was never the plan. It's always been about being able to manage the spread of infection, testing, tracing, tracking. All that has been what we've been developing and having the equipment on island. But no, we knew as we went into our new what we call phase 5B with 7-day testing, we would pick somebody up. It's good that we picked something up because it shows it's worked. If we hadn't done, we'd actually have been worried because the science would tell us that statistically we should have been picking up somebody by that point. It was about 2 weeks into the new phase.
And these people who aren't keeping to the lockdown, you're hitting them more in their pockets and we send ours to prison, it seems, in our case, but you have £10,000 fines or something,
We do, up to £10,000 fine.
Have you had many?
We've had about three, about 3, 4. But really, it's to give that message. It's really important to us. It's and I know to say the UK it's got very low fines, but for us it's really important that people stick to the regulations.
And you've got good tracking going on, have you? Everyone gets seen or talked to?
Everybody gets followed up, and there are very clever ways that the guys are making sure that people are keeping to the regime.
Finally, you're just a little bit away from an election, aren't you?
We are
Island-wide. How many people on this ballot? It's amazing.
119.
Is it a major item that everyone's standing on? I mean, is everyone on the same page, keeping the lockdown as it is, or is there another thought you want to open it up?
It really is quite fascinating because if you read some people's manifestos, you wouldn't even know the pandemic was here. I mean, it's very much focusing on what might happen in the future, rather than understanding that we're still in it. It hasn't gone away, and that health side we still need to follow. And really, for me, it's making sure that is kept through beyond the election. Just because we have an election doesn't mean the pandemic's gone away, and really it's focusing people's minds on that. I think from a general population point of view, very much aware that it's still around. You only got to see what's happening further afield. I mean, we've only got France on our doorstep, and the number of cases have rocketed there. And we've got the UK to the north, and we're seeing the trend of the prevalence going up. So I think that it should be part of the debate. I think there is a focus on the economy, and the impacts of the pandemic on the economy is a really strong focus for people, and quite rightly so. We're going to have to build back from all the impacts that the pandemic has had.
The Isle of Man piggybacks on the UK or England NHS, and if and when the vaccine happens, that's how we'll be getting it. Do you have to go and make your own arrangements? Have you been buying some in advance, or?
We are through work through the NHS supply chain on that fact. Right. So in theory, we should get the proportionate amount of vaccine, and we've been building how we do that. So we've had to change the law to enable us to use a vaccine that might not be fully licensed, because our law currently wouldn't allow us to do it. So making sure we've got all our ducks in a row before we go out there and administer the vaccine.
And how bad was it at the height? I mean, Jersey built their own Nightingale sort of hospital, didn't they? We didn't actually need it in the end, but we had pressure on our health service. Did you have the same thing at one stage? Was it? The nursing home had one bad case. We had one particular. We had two nursing homes which unfortunately had the virus, and one was more badly hit than the other. The hospital was pretty much kept calm. We had no problem. We had 252 cases in all. We had, I think at the maximum at one point, we had 6 people hospitalised. We had nobody in intensive care, I don't believe. Did you have to stop all the other operations and things like that?
Yes, because we had to make sure that we didn't enable the virus to spread, so that impacted what operations we could undertake. We did keep going on our outpatients, and as much as possible we kept going, but clearly that it hasn't impacted.
Are you ready for a second wave then? I suppose is the last question.
Well, we have to be ready for the second wave. A lot of planning's gone on for that. We've learned from what happened first time, what we did first time around. We converted our day patient unit into basically a hot ICU for people. We might do things a bit differently next time, but that is all the work that guys are doing. I'm really impressed by the whole team. It's been such a fantastic team effort, and that's we managed to get out that this. I don't know if it's luck, but I think it was planning. It was and at the end of the day, for me, it was that feeling of Guernsey together. It really did come through.